Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining us again today.
Hi, my pleasure.
Absolutely. So my name is Dilshad Burman. I'm a writer and reporter with City and CityNews. Before we start today, I just wanted to acknowledge that it is National Indigenous Peoples Day, and I'm wearing orange today to honor and remember those that were lost in the residential school system and also the survivors today. So if we could all take a moment to reflect today, that would be wonderful. And now we're going to get back to our regular programming. Doctor, the way it works today with the doctor is we have been collecting your questions over the past week. And I will ask the doctor them today. Now, she's never seen them before. It's all off the cuff, so none of this is planned. You can also continue to submit your questions if you haven't had a chance to do so under this live broadcast, and we'll try to get to as many of them as we can in this short 30-minute period that we have with the doctor. I'm going to make sure that we are recording this, so we can look back on this later. Doctor, are you ready to go?
Yeah, let's go.
Okay, wonderful. So let's start with some vaccine questions. I'll try and mix it up today because we've had a lot of questions that are not related to vaccines as well. So we'll start with the vaccine ones and get to the others later. Starting with Meg. This is one that we haven't had before, and I was very interested to know. Meg says, I read online that you should wait a few days after getting your COVID vaccine before getting a tattoo. Is this true, and is it enough to wait a week, or do I need to wait longer?
Well, actually, the best way to answer this is you're not allowed to get a tattoo right now. I mean, tattoos will be open when personal service settings will be open, like typically when you can get a haircut and stuff. So that's the first thing, is that a legal tattoo is actually not allowed right now. In terms of waiting before you get a tattoo, there's no real linkage to the COVID vaccine and either blunting your immune response or making it more risk. Certainly, though, if you have symptoms, we wouldn't recommend that you go into any place, a store or anything that you can hold back on. So that might be part of the reasoning why you might have read that, is it's in the first 3 days that you're more likely to get symptoms, and that may be why they might have said to hold off if you were just reading it more broadly.
Okay. And then Andrew asks, and we have covered this before, but always good to reiterate. Andrew says that he would really like to hear more about the myocarditis symptoms after the second dose of Pfizer.
Okay, so the symptoms are more common in young males, young adult males. So really in the range of, say, 12 to 24 or so. And the symptoms are chest pain, trouble breathing, palpitations, usually within the first 4 days after vaccination are signs that you could go to an emergency department to get looked at.
And Doctor, you mentioned earlier, you said it was in younger males that this was happening. Has it been, definitively connected to the vaccine?
No, it hasn't. And actually, we were waiting for the American Advisory Committee on Immunization to present their data. It was supposed to be on Friday, but got postponed because of their new statutory holiday.
Right.
So we are still closely following this in terms of to see whether it may or may not be linked to the vaccine. But in the meanwhile, if anyone has those symptoms following vaccination, it's a good idea to talk to your doctor or go to an emergency department to get looked at.
Okay. And then here we go. This is an interesting one here from Minnie. They ask, will it be required for personal service providers in hair salons or nail salons, for example, to be vaccinated before they open their stores? And if they're not vaccinated, do you think they will be required to notify their customers?
Okay, so right now I'm not aware of any legislation requiring that for this particular sector. I'm actually only really aware of it for the long-term care homes have guidance on that. Mm-hmm. Some post-secondary institutions like universities or colleges have put together stuff. There's certainly nothing specific to this sector. Now, each store could have their own policy. Each owner of the store could decide for the workers or even the customers that attend that they were going to handle things in a particular way, but there are no mandates right now.
Okay. And we have quite a few live questions coming in right away, so I'm going to pick up a few of them. Let's start with Deborah. And Deborah is actually asking a question that we have had submitted over this past week. She asks, why aren't we acknowledging natural innate immunity? Lots of people already have this. And referring to the question that we had submitted over the week, do we have sort of a percentage, or do we know how many people are just naturally immune to COVID?
Well, we know how many people have actually had COVID in our city, in our province, in our country, and it's quite a lot of people. But we still know, though, that if you got COVID, you could still get COVID again. And the way to think about this is, if you've ever had a cold in the wintertime, for example, it's not like, okay, I had my cold this winter, I'm not going to get another cold. Sometimes you can get a cold again, and even sometimes from the same virus. A coronavirus can give you a cold once, and many months later can give you another cold. And that's the same thing with COVID, is that the immunity that you get from getting COVID may not last. It doesn't last for all people. Some people have had COVID more than once, and it also may not protect you against variants. So that's why we recommend that you get vaccinated.
And doctor, aside from people who have had COVID, is there any sort of evidence to suggest that people, even without having COVID, are just already immune to it? They just can't get it?
If you had immunity, it would be that you had COVID. Now, it could be that you had an asymptomatic infection, or you had an infection that you didn't get tested. You had symptoms but didn't go for testing and you had COVID. That would be, but it's not that we're born with it or because other people around us had it. If you would only get immunity because you actually got COVID, whether it was symptomatic or asymptomatic.
Okay. And then lots of live questions coming. Let's go to Helen. Helen asks, we have friends that are fully vaccinated. Can we gather?
Well, right now we have to follow our gathering limits. Like right now, it's not based on if you're vaccinated or not vaccinated. That's not the situation right now in Ontario. So you can certainly get together 10 outdoors. It's going to be safer because you're vaccinated, but you still should keep that physical distance from people you don't live with. I think we have to recognize that Delta variant is still something that we have to be mindful of, and it's spreads more easily. We've seen in other parts of the province where it's really can take off and spread in the right circumstances.
Right, absolutely. And then, Darlene asked, we've got a lot of questions about the mixing of Moderna and Pfizer this week. So let's take Darlene's here. Is it safe for someone with a compromised immune system to combine the Moderna and Pfizer vaccines?
So yes, it is safe. So I think the way we should think about Moderna and Pfizer is they're two different names for almost identical vaccines. And so I want you to think about the MMR vaccine. We actually have different names for the MMR vaccine, but we actually don't refer to it by the drug company's name. We call them MMR vaccines. And that's the way we need to think about messenger RNA vaccines going forward now. They're pretty identical, and we do this with other vaccines too. If we only have supply by this manufacturer, we give that one, and that's the situation we're in right now, where we have a lot of Moderna now coming in this week. It's a very good vaccine, equivalent to Pfizer, and we need to get more people vaccinated with first doses, and we need to also finish up people who have had their first dose to get their second dose, because that's going to help us prevent the spread of the Delta variant. Yes. And so if you have an opportunity to get your second dose, your first dose with Pfizer, and the second dose is Moderna, please do take that opportunity, as long as you don't have a severe allergic reaction to any of the ingredients. And there's only one additional ingredient in Moderna, that's tromethamine, which is, again, very rare to have an allergy to. You would be safe to get the vaccine, and it would be recommended, because, again, the longer you wait to say, okay, I'm going to wait to get Pfizer, I can't guarantee that you're going to be able to get Pfizer even the next week or the week after. And then again, it's just that much longer before you could get that full immunity.
Absolutely, yeah. In fact, we have related questions about the mixing of the doses. So let's talk about that. Joyce asks, those that signed up to be vaxxed in a Toronto Public Health unit before they added just the Moderna appointments, will they still be able to get Pfizer this week?
We don't have Pfizer available for everyone. And so, and I think that for the longest time, actually, all we had was Pfizer, and we had a lot of Pfizer at the beginning of June. Now we have a lot of Moderna, and so that's what we're giving. The Pfizer is being saved for the youth, the 12 to 17-year-olds, because that is the only vaccine that they can receive. And so what little Pfizer we have is going to be saved for the youth, and really most adults will be getting Moderna. All adults actually will be getting Moderna. It's nothing to be concerned about, and it's certainly something that I would recommend. Remember, with that Delta variant, we know the first dose gives you, 30 to 50% protection, but that second dose of a messenger RNA vaccine will take you beyond 90%. But it takes 2 weeks even for the vaccine to work. So again, the more we delay, the more you'll be delayed into the summer before you have that better protection.
Right, absolutely. And on a personal note, I am getting my second vaccine this week. I got Pfizer for my first dose. I'm pretty sure I'm getting Moderna for my second. Taking it anyway. I am sick of delaying my summer fun. And so I just want to feel protected, and I want to feel like I did the right thing. And so we're going ahead. We're going to be taking the second dose. Whatever they give us, we will take. Because like you said, mRNA vaccines are interchangeable. And I think the thing that makes the most sense to me as a layperson is exactly what you said. The MMR vaccines, measles, mumps, rubella, that kind of stuff. We've never known the brands of vaccines. It's just that now, because Pfizer was first out the gate, we learned the name. We know that it's Pfizer. But most of the times when we get vaccines, nobody tells us brand names. It's just, I got the MMR shot. So I think that to me as a layperson makes a lot of sense in terms of easing my mind as to the differences between the two brands. There's no difference really.
Yeah, and in some ways what I like to do is say it's an interchangeable schedule. Pfizer and Moderna are interchangeable, versus AstraZeneca and a messenger RNA vaccine. That's really your mixed schedule. You're using a different type of vaccine with another different type of vaccine. Still works. That's what I would more reserve mixed schedule to. This is really an interchangeable schedule.
Right, makes sense, absolutely. And then, okay, let's do the live questions. So many coming in today. Here we go. Mina asks, Doctor, I was tested positive for COVID-19 and now I'm negative. How many days shall I wait until I get my first vaccine shot?
Okay, Mina, I'm sorry that you got COVID, but I'm glad that you're getting vaccinated. As long as you are out of self-isolation, you can go ahead and get vaccinated.
Right. And then we just talked about this, but it's more of a statement than a question. I'll ask it anyway. Stephen Waldman asks, is there proof, show us proof from Moderna and Pfizer that they say their product is interchangeable, not from NACI or what you feel or think? What is the proof?
Well, actually, we've made a lot of very important decisions during COVID based on vaccine science, based on what we know. I mean, we haven't thrown any of that out. I mean, think about even something like ibuprofen. Most people know it as Advil or Motrin. Actually, it's the exact same medication, two different names. Now, the messenger RNA vaccines are pretty identical. And so we're at this situation now where, again, we have the Delta variant on board. We have a lot of Pfizer. We don't have Pfizer this week. And so in order to complete your schedule and have that earlier, better protection against the Delta variant, getting the second dose of an interchangeable vaccine, which is the messenger RNA vaccine, is recommended. The proof is that we know that they're very similar vaccines. And we do this in vaccines. We do this. This is not uncommon, and gives us that protection which we expect from vaccines.
Absolutely. And then, sorry, I'm just trying to field all these questions here. Let's go to Andrew. Andrew says, when will the government discuss antibody testing, which is immunity from a previous infection, as it equates to vaccinated immunity for travelers? I know this might be a federal or provincial question, but if you could take a stab at it.
Yeah, so really, if you're vaccinated, it's the proof of vaccination. It's not the antibody status. We don't have, this is getting a bit technical, but we don't have what we call correlates of protection. So we don't have a blood test to say, if you get this blood test and your level is X, that means that you're protected from your vaccination. We actually don't have that kind of blood test. Even the antibody tests that we have are not specific enough for the vaccines. And so that's why, you know, getting people to do a blood test and holding on to that is not what we would recommend. It's really that proof of vaccination, that vaccination record. And again, that's very similar to other vaccines as well.
Right, absolutely. And then Christine asks, people that have had both vaccines are dying from the Delta variant. As an immunocompromised person, this is very concerning to me. And returning to a large office without herd immunity, she says, how dangerous is that? Should I stay on leave?
Right. So unfortunately, yes, I mean, some people who have been vaccinated have gotten very sick. And I think what this speaks to is this is why we need more people around them vaccinated. This is why we need to prevent the spread of COVID. Because if you yourself are very old, for example, you have a weakened immune system, the vaccine may not give you as much individual protection. But if the people around you are vaccinated, if you can prevent being exposed to COVID, that will help to protect you. Now, I think the important thing to note is that even with the Delta variant, wearing a mask, physical distancing, staying home with your sick, all of that stuff really works as well as vaccination. And so keeping up with some of those measures, especially if you have a weakened immune system, is another thing that you can consider.
Absolutely. Okay. Let's go back to our submitted questions here. We talked about mixing doses. All right. Okay, I'll take Janet's question. Again, I know that this is sort of maybe a federal question, but can you guarantee that mixing Pfizer and Moderna will be acceptable worldwide as being fully immunized? Some countries have indicated that this is not considered fully immunized and you would require quarantine on arrival. From the efficacy standpoint, I know that it's fine, Janet says, but wouldn't want more travel restrictions because of this issue.
Yes, Janet, that's something that's definitely been flagged, been raised with all levels of government to address that. Because we certainly wouldn't want the fact that you had a mixed schedule, especially when it's being recommended, especially when that's the vaccine that we have available, for that to in any way cause, you know, those kinds of restrictions in the future.
Right. In fact, there's a couple of other questions regarding the AstraZeneca vaccine when it comes to travel. So I'll take those. Lucy and Wings actually have a similar question. Lucy says, I received 2 doses of AstraZeneca based on listening to government advice about obtaining the first vaccine that was offered. And now NACI has implied that I have chosen the wrong course of vaccine. If they believe that AstraZeneca is problematic, then will anyone who received AstraZeneca have the option to be revaccinated with an mRNA vaccine? And when would that likely start?
Okay, so if you had 2 doses of the AstraZeneca vaccine, feel confident that you've completed your series and no more action is required. When NACI made its update to say, okay, for getting your second dose, preferred to get messenger RNA, a lot of that is also related to the rare blood clots. Now, you've already gotten your second dose. You did not get the rare blood clots. And so you actually still have good protection with those 2 doses of AstraZeneca vaccine. And, you know, there is no recommendation down the road that you get a third dose of, say, a messenger RNA vaccine. Now, so down the road, all of us may need a third dose. I mean, there may be a role for a booster dose for all of us in general. We don't have that guidance right now, but there certainly is nothing to say that if you've had 2 doses of AstraZeneca vaccine, you've made a poor choice, that it's not going to provide you the protection that you need. And so I just want you to know that.
Absolutely. And then Wings just sort of had a related question. I'll just mention it, but you pretty much answered it. Would you need to be revaccinated with a US approved vaccine for travel to the US?
So this is the piece that has to be sorted out from a kind of a policy perspective, because that's certainly not what the intention is. If you've had those vaccines, that just because a certain country has certain vaccines that you can't travel there. So I think we're going to have to wait a few more days to see how this sorts itself out from a federal perspective.
Right. And then this is more of a general question, but really important. Jude asks, Some people are telling me that they're not going to get vaccinated because there's no proper data about vaccination. What would you say to them?
Okay, I would say there's actually a lot of data about vaccinations, but I actually think the best way to answer this question is not with data. I think the best way to answer someone who talks about this is to talk about COVID and to say, you know what, COVID has impacted me so severely. I want to get out of the pandemic. I want my kids to be able to go and play with other kids, or I want to be able to go and see my family. And that's why getting vaccinated is important for me. And I think sometimes those stories explaining why vaccination is important can sometimes be more significant than data, because sometimes data can't change someone's mind. I think the other thing is when we talk about risks and benefits, people talk about theoretical risks of vaccination, but we have to compare that to the real risks of COVID, real risks. You know, people today even are dying from COVID, even in our province. And so we have to continue to remember that.
Right, absolutely. And then let's ask this one. Riz asks, which vaccine is best suited for just common people with a normal immune system, and which vaccines are suited for seniors and why?
Well, actually, the vaccine that we have this week is Moderna, and as long as you're 18 years of age and older, it would be very well suited for someone who's a senior, an elderly. It was studied in seniors, someone who has a weakened immune system, someone who has chronic health conditions, and also someone who's very healthy. The messenger RNA vaccines, which are really our choices, Moderna or Pfizer, those are good choices for all of those groups.
Okay. Let's see. All right. Rose asks, and I'm not sure we're actually still doing this, but I'll ask it anyway. Are the AstraZeneca doses that they're giving out currently the ones that expired and then got extended, or have we used all of those up already?
Okay, so my understanding, I can't say definitively. I think if this is the question that you had and you're getting your second dose AstraZeneca, you can certainly ask the person vaccinating you. But the large shipment that we got, the expiry date was extended, and I don't believe we got additional shipments beyond that, but I can't be 100% sure on that.
Okay. And then Linda asks, she doesn't mention which vaccine she got, but she asks, I had side effects for 3 weeks after my first dose of the vaccine. Do you think it will be the same for the second dose?
Okay, so I think, so Linda, I'm sorry that you had side effects. If you had side effects for 3 weeks, I would definitely recommend that you see your doctor to get the side effects reported to public health so that we can do an investigation and then give you a good recommendation on what to do about your next dose. Just because you had side effects after your first dose does not mean that you're going to get side effects after your second dose. I know a lot of people are really worried about the side effects after the second dose, and some people have none. They're so worried and they have none. Some people do get a fever, do feel unwell, but it lasts for a day and then they're better the next day. It's extremely difficult to predict.
Yeah, absolutely. And just on that note, just from hearing anecdotal, things from people that have gotten vaccinated, they told me to put out this advice. If you have kids and you're getting your second dose, try not to get both parents vaccinated on the same day, because one of you might be out of commission for that one day, and make childcare arrangements. This was something that was very strongly recommended. I thought I would put that out there because it's good advice. If both of you are down and out, who's got the kids? So just a little friendly advice there. Yeah, and same way if you're working. Like I know some people are worried they might not be able to take the next day off work, and so maybe plan your vaccinations for the day before you have your days off. Absolutely. And let's go with Nidhi's question. There's another live question coming in here. Nidhi Gemini says, even if most of the adults are vaccinated, school-going kids under 12 years will not be vaccinated come September. What is your opinion on in-school attendance for this age group? They are still at risk, especially with the Delta variant. Yes, I mean, all of that is very true. I think the more adults and 12 years and up we get vaccinated, the more we will protect those who are under 11. And I think by actually getting our community COVID rates very low, it means that even in schools, the kids won't be able to spread it. So I think that's really the goal that we're trying to get to. But that also being said,
even if you can't get vaccinated because of your age, there are other things that can be done to help to prevent the spread. And so some of those measures will probably be in place in school to help to prevent the spread, like having the class in a cohort, not mixing cohorts, that kind of thing.
And in fact, we had a question from a grade 6 student who actually asked, is it safe for me to go back to school in September? And so, Doctor, could you elaborate a little bit on the measures that are being taken to keep kids safe?
Yeah, I mean, I think we saw this past year, it was actually safe to go to school. And when our rates of COVID got very high, that's when all schools were actually moved to virtual learning. The many layers of protection and public health measures made schools a place where COVID didn't spread very quickly. And so I think that will be the goal in September. Now, how many measures will we need in September compared to last year? Because we have vaccines, that's the part that expert guidance, scientific guidance will be required in order to help guide that.
For sure. And September is a ways off still. I know that the months are going by fast when it comes to COVID, but hopefully by September, everything will be sorted out. Okay, let's go back to our cache of questions here. Actually, we just asked about children under 12. So Denise asks, when will children under 12 be able to get vaccinated? Do we have an updated timeline on that?
Yeah, nothing new to report on that. Again, still waiting for the studies have to be completed, and I don't believe they've been completed yet. And then they have to go to the regulator, Health Canada, for approval. So it's still, nothing is kind of right around the corner on that.
Right. Okay. And then we still have a few minutes here. So Sandra and Roger have a similar question. I would like to know, Roger says, I would like to know why a person who already had COVID-19 would have to be vaccinated, taking into account that the immunity that the virus leaves in the person who had it is much higher and more effective than the immunity caused by the vaccine. This is what Roger says. Could there be a conflict between the immunity left by the virus and the immunity caused by the vaccine?
Yeah, Roger, it's a good question. Like usually with viruses or bacteria, if you've had the infection, you have very strong immunity compared to vaccination. That's the case for some diseases. But when it comes to coronaviruses, in particular this SARS-CoV-2, it actually does not seem to be the case. And so if you've had the infection, your immunity actually wanes. We see that, and people have gotten COVID more than once, and so that's really why the recommendation is for the vaccination. The vaccination won't conflict with your natural immunity. It may boost it to actually give you that protection that you need. It won't be a conflict.
Okay. And then let's take, Denise has two questions. Let's take her first one. Denise says, I had uric acid problems 3 years ago. Is the vaccine still good for me?
Yes. So even if you have a high uric acid or you had gout before, even kidney stones, the vaccine would still be safe and recommended.
Okay. And then the second part of her question is, after I get the vaccine, is there any rest needed? Do I need to increase water intake or vitamins or anything like that?
Yeah, I think for your specific health situation, like it's always best to have those questions with your doctor or your nurse practitioner. But in general, after you get vaccinated, you know, you really can watch your symptoms. And if your symptoms are, you know, you have a lot of muscle aches, well, you can take some over-the-counter medications. If you're feeling tired, you could rest. Mm-hmm. Certainly, drinking water is a good thing. Staying hydrated is certainly a good thing too.
Right, absolutely. But not specific to the vaccine. That's just in general, that's good advice.
Based on how you're, like if you got a fever after the vaccination, well, you want to make sure that you stay hydrated and don't get dehydrated. Yeah.
Absolutely. Okay. And then this is an interesting one. Ankit asks, has Health Canada approved the Covaxin vaccine from India to consider travelers as vaccinated?
I believe right now, I think there was just an announcement today about Health Canada approved vaccines for permanent residents returning, for example. Covishield that came from India, which is the same as AstraZeneca, is something that we've used here. But beyond that, we haven't, Health Canada has not approved any other vaccines.
Okay, okay. And then Melissa asks, what is the difference between Canada and the US? Why are they allowing fully vaccinated people to take their masks off and we're not allowed to do it?
Yeah, so I think that guidance is in the works, as I understand, will be coming. What we're waiting for here is actually for our COVID-19 rates to still come down. I mean, we're still seeing the effects of this Delta variant and causing a large number of cases in certain parts of the province. And so I think that's part of what's going on. I haven't heard very much about the Delta variant in the US, and so that may be one of our key differences so far.
Mm-hmm, mm-hmm. Absolutely. And then we actually have 2 minutes, and so I'm going to do some non-vaccine related questions. This is a question we had so often during the first wave of the pandemic, and now it's coming around again. Fran asks, do you think that we still have to wipe down our grocery bags? I am very concerned that every time I bring home groceries, the bags and the food that I bring home may contain COVID. Is this true?
So we actually didn't really recommend having to wipe down your grocery bags. Really what we recommend is once you put your grocery bags down, wash your hands, put your groceries away, then your bags, if they're washable, you can wash them, and then to clean the surface. But actually physically wiping down the groceries is not recommended. Washing your hands before and after you handle things certainly is. And the reason I think it's even more clear is that the spread through contamination of surfaces is much less from this virus. This virus is really spread from close contact with others, from sharing indoor air spaces in particular with others.
Right, okay. And then I guess we just have the 1 minute left. How many Lady asks, how many people can we have indoors in a wedding ceremony in this phase 2?
So for the ceremony only, it would be for the religious, the ceremony itself, you can have, I believe it's 15% of capacity of the room. So that's what's allowed in phase 1, stage 1.
Right. In a religious institution, right? In a church or a temple.
It doesn't have to be specifically a religious institution, but it has to be only for the religious ceremony. So you could not then have the reception there. For a reception, indoor receptions are not allowed at all. Yeah.
Okay, and that brings us to 1 o'clock. Thank you, doctor, for taking the time and having the patience to answer all these questions again this week. Thank you to everybody that submitted live and over the week as well. The doctor will be back with us next week. So if you have any questions, please submit them and we'll take them next week. Thanks again, everybody. Bye-bye.
Thanks. Bye.